Polycythemia vera is a type of blood cancer that starts in the bone marrow, where new blood cells are produced. This causes an overproduction of red blood cells, making the blood too thick and increasing the risk of clots, stroke, or heart attack. PV progresses slowly over many years and can be life-threatening without proper treatment. It is most commonly diagnosed in people over 60, but can occur at any age, with men being more likely to develop it than women. If you are diagnosed with PV, it's normal to feel worried. It's important to remember that everyone's experience with cancer is different, and with the support of your doctor, family, friends, and others with PV, you can effectively manage the condition. In your bone marrow, 3 types of blood cells are made: red, white, and platelets. The red blood cells carry oxygen, the white blood cells fight infections, and the platelets clot your blood to stop bleeding. People with polycythemia vera often have an excess of red blood cells, but it can also lead to an increase in white blood cells and platelets. Polycythemia vera is usually caused by a gene, either JAK2 or TET2, that does not function properly. This gene mutation most likely occurred during your lifetime, but in rare cases, it can be inherited from parents. As polycythemia vera progresses, you may start experiencing symptoms such as headaches, double vision, dark or blind spots in your vision, itching all over your body, especially after being in warm or hot water, night sweats, a red face that looks like sunburn or blushing, weakness, dizziness, weight loss, shortness of breath, tingling or burning in your hands or feet, painful joint swelling. You may also feel pressure or fullness below your ribs on your left side, which could indicate an enlarged spleen, an organ that helps filter your blood. Having polycythemia vera, or PV, can lead to serious health complications. Blood clots could result in a heart attack, stroke, or DVT. They may also enlarge the liver or spleen, leading to chest pain or heart failure if organs don't receive enough blood. Additionally, having too many red blood cells can cause stomach ulcers, gout, or kidney stones. Furthermore, PV can also increase the risk of developing more serious blood diseases such as acute leukemia, which is a rapidly worsening blood cancer, and myelofibrosis, a condition where the bone marrow fills with scar tissue. Once you visit your doctor, they will conduct a physical exam that includes checking your spleen and asking about any symptoms you may be experiencing. They will also assess if your face appears unusually red. You may undergo several blood tests, including a complete blood count, CBC, to determine the number of red blood cells, white blood cells, and platelets. An abnormally high count of any of these could indicate polycythemia vera. Additionally, a blood smear may be performed to check for other diseases associated with PV, and your EPO level will be measured to determine if your bone marrow is producing an excessive amount of blood cells. In some cases, a bone marrow biopsy may be necessary to confirm the diagnosis. This involves taking a small sample of your bone marrow from the back of your hip bone. The procedure is outpatient, meaning you do not need to stay in the hospital overnight. Before your appointment, it's a good idea to prepare a list of questions for your doctor, such as inquiring about recommended treatments, potential side effects, prevention of complications, and the likelihood of stroke or heart attack. Additionally, you may want to ask about managing your symptoms. If you're not experiencing many symptoms, you may not need immediate treatment for polycythemia vera. Your doctor will monitor your condition closely. However, if treatment is necessary, it will focus on reducing the production of red blood cells and preventing complications such as blood clots. Here are some options for treatment. Phlebotomy. This involves the removal of blood from your vein to reduce the number of blood cells. It's similar to donating blood and can help alleviate symptoms such as headaches and dizziness. Low-dose aspirin. This medication prevents platelets from sticking together, reducing the risk of blood clots, heart attacks, and strokes. Most people with polycythemia vera take low-dose aspirin. Medicine to lower blood cells. Options include hydroxyurea, interferon alpha, ropeginterferon alpha, 2B, NJFT, busulfan, and ruxolitinib. These medications work to lower red blood cell count and ease symptoms. If you experience persistent itching, your doctor may prescribe antihistamines. To keep yourself comfortable and as healthy as possible during treatment, there are a few things you can do. Avoid smoking or chewing tobacco, as it narrows blood vessels and increases the risk of blood clots. Engage in light exercise, like walking, to improve circulation and maintain a healthy heart. Perform leg and ankle exercises to prevent the formation of clots in the veins of your legs. Your doctor or a physical therapist can demonstrate how to do this. Take cool baths or showers if warm water causes itching. Keep your skin moisturized and avoid scratching to prevent irritation. Unfortunately, there is currently no cure for polycythemia vera, but with the right treatment, you can effectively manage the disease for many years. It's important to talk to your friends and family about your condition, and you may also find it beneficial to join a support group for individuals who are going through similar experiences. For more information and to connect with support groups, you can reach out to the MPN Research Foundation. They have valuable resources and can assist you in finding the support you need.